Dr. Nancy Rahnama. I'm an internist and bariatric medicine specialist. I started my practice in Beverly Hills 10 years ago, focusing on clinical nutrition and weight loss. Today, I'll be answering your top questions regarding the new weight loss medications available. So what are these weight loss drugs that everybody is talking about? Well, those Ozempic-Wegovy-Mounjaro, which has been FDA approved for diabetes. And then there's Wegovy, which is actually FDA approved for weight loss. But even though they're FDA approved for two different medical issues, they are generally the same exact medication. And they target obesity at its core. How do they do that? Well, we now understand that the reason why it's so hard for someone to get to their weight loss goal is because that while someone is losing weight, the body responds by stopping the production of a hormone called GLP-1. GLP-1 is the hormone that makes you feel full. So if you continue to lose weight and your body stops producing this hormone, you get very hungry. And what do you do when you're very hungry? You give up on your weight loss efforts and you stop losing weight and gain all the weight back. But now, these two drugs are giving you a protein that acts exactly like GLP-1 so that you don't get hungry, you're able to continue with your weight loss goals, and more importantly, you're able to stay there. So how quickly do they actually work? Well, as soon as the drug is administered, within 3 to 5 hours, you're gonna feel full. You're not gonna be as hungry as you have been in your entire life. That voice that constantly tells you to go eat and grab a snack and eat more and wondering about what you're gonna eat and is it gonna be the right food and will it contribute to weight loss versus weight gain, that switch turns off. And you can see up to 5 to 10% of weight loss within the first month. Of course, that depends on how much weight you have to lose. Someone who has an excess of 100 pounds to lose is obviously going to lose more than someone who only is overweight by 20 pounds. But at the end of the day, it's significant weight loss because it's targeting obesity at its core. So what's the catch? This sounds way too good to be true. Well, there can be a catch, and that could be the cost. So depending on the insurance carrier that you have, if you have blood work that suggests that you're a diabetic, your insurance company will cover either Ozempic or Mounjaro because those are FDA approved for diabetes. And if you have diabetes in addition to weight to lose, then you get those drugs. If you are not a diabetic, but you meet the criteria for weight loss, which would be a BMI greater than 30 or a BMI greater than 27 with a comorbidity such as high cholesterol, high blood pressure, joint pain, sleep apnea, fatty liver disease, and many more. If you have a BMI of 27 and one of those things, then your insurance may cover Wegovy. Wegovy will only be covered if your insurance recognizes obesity as a medical problem. If it doesn't, and you're not diabetic, then you might have to pay for the drug out of pocket, which could be anywhere from $1,000 to $1,500 a month. So who can't take these drugs? The people who can't take them are patients who are either pregnant, breastfeeding, or have a personal or family history of a very rare type of thyroid cancer. Who shouldn't take these drugs? People who shouldn't take these drugs are people who have not been evaluated by a physician who understands how the medication works and when to prescribe it appropriately. If you have been to a doctor and you have been cleared and the doctor has prescribed this medication to you appropriately, meaning because you're a diabetic or because you meet the obesity criteria, then this drug can change your life. So what's the summary? There is a whole new world of weight loss medications that address the exact physiology of weight loss and why it's so hard for people to reach their weight loss goals and stay there. These group of drugs are either covered by insurance if you're a diabetic or if you have a medical carrier that recognizes obesity as a medical problem. Make sure you are a right candidate for this drug. Ask your physician or check out our website to find out more and make sure that this drug is right for you. And have yourself monitored. Make sure that you're losing adequate weight because 5 to 10% of your weight loss can be achieved within the first month. Thank you guys so much for watching. This is part 1 of a 2-part video series where we will be answering your questions regarding the new weight loss medications out there. I hope you loved this video. If you did, please make sure to like below and subscribe to our channel to make sure you're up to date on all the news on gut health, nutrition, and weight loss.